Hello, I'm Dr. Arifa Kassaboy, a practicing internist and a medical editor for Medscape and WebMD. Welcome to our weekly brief on recent medical news and findings. First, a new study confirms that the digital rectal exam is not necessary as a first-line screening test for prostate cancer. The trial involved more than 38,000 men. It found that the exam would need to be performed in almost 1,400 men with normal PSA levels in order to detect a single case of clinically significant prostate cancer. The American Urological Association says it may be useful in men with an elevated PSA as a secondary test. Cutting back on use of the digital rectal exam for screening purposes could be good news for many. The discomfort and embarrassment associated with the exam does deter some men from being tested for prostate cancer. So, while PSA testing guidelines vary, you can feel comfortable that the USPSTF, the AUA, and the American Cancer Society all do not require the digital rectal exam for primary screening for prostate cancer. Next, obese Americans are being dramatically undertreated. Previous studies in the U.S. estimate that 116 million adults could benefit from anti-obesity pharmacotherapy. Yet only about 2% are actually being treated with the drugs. Now compare that to how diabetes is treated. This retrospective analysis found that 15 times more diabetes drugs than weight loss drugs are prescribed in the US, and that didn't include insulin. The new SGLT2 inhibitors for diabetes have been adopted at a much faster rate than the newer anti-obesity medications, though all entered the market around the same time. Those newer agents include Belviq, Kisimia, and Contrave. Of course, it should be noted that SGLT2 inhibitors can result in weight loss, which may contribute to their popularity. And the researchers acknowledge that there may be a reluctance to use weight loss medications. The reasons include questions about long-term safety and insurance reimbursement, and clinicians may hesitate to look at obesity as a chronic disease that needs treatment beyond diet and exercise. Plus, some doctors don't have the training to comfortably prescribe the drugs. And finally, if you think your patient doesn't take his blood pressure meds daily, you're probably right. The CDC and the CMS report that more than a quarter of Medicare patients with hypertension were taking their high blood pressure medications less than 80% of the time. That's about 5 million individuals. One thing that influenced compliance was the type of medication used. Non-adherence was highest with diuretics and better with combination pills. So the next time you're with a patient struggling to get his blood pressure under control, ask him if he's taking his meds every day. You may be able to simplify the blood pressure medication regimen or address another issue and improve compliance. You'll find links to each of the stories we've included in today's news brief in the transcript listed below. For Medscape and WebMD, I'm Dr. Arifa Kassaboy.